I'm a month out.
Oh, great.
All right, good morning. I want to talk to you a little bit about stomach cancer, diet, salt, Helicobacter pylori, and the MGB. And so there's some recent research which I think is worth putting on our videos. And this is where I have to say something kind of embarrassing, and that is, how do you keep up with all the latest research from me? In other words, we have people that have had the MGB a year ago, 2 years ago, 5 years ago, 10 years ago, 14 years ago, and just the other day I got a wonderful email from one of my patients who's 13 years out and hadn't kept up on some of the research. So how can we do that? Well, one is, of course, you can come to clinic. If you're from far away, like we have patients from Pakistan and England, Maine, Alaska, that's a little challenging. We certainly encourage that. You can watch the videos, but you might not know when to go back and things like that. So now I'm going to say something that makes me kind of a little embarrassed, and that is for you to stay up to date on the latest videos, as like the example we're doing this morning, we recommend that you follow me on Twitter and friend me on Facebook. Okay, now let me see if I can justify that. It's really hard to say, but 14 years ago I started using email to communicate with my patients, and I got tremendous criticism. People said that's a terrible idea. Now I think email, a lot of people agree, is reasonable. I had a web page 10 to 14 years ago, and many of my colleagues were bitterly critical, saying you shouldn't use a web page to communicate with patients, and I think now that's been shown to be a good idea, and those critics are silent about the web page. The interesting thing about Twitter and Facebook is that when I do a video like the one we're doing now, you'll be notified and you'll get that in your inbox. And so you don't have to keep track of anything. You'll just get, when you check your email, an alert that there's a new video on YouTube that you can watch, and that way you can stay up to date. The other thing we do is when I am reading research about obesity, weight loss, gastric bypass, lap band, things like that, I can highlight it and store it on something called Amplify. And the reason I mention that is if I find an article, a scientific article that I think is valuable to you, like I'm going to talk to you, as I said this morning, about Helicobacter pylori and stomach cancer and a healthy diet, I can highlight that, save it to Amplify, and when I do that, it will go out to Twitter and to Facebook. So we would like you to stay up to date on all that research, and you can do that easily if you, I'll say it one more time, follow me on Twitter and friend me on Facebook. Good morning. Come on in, have a seat. Oh, no, you're not late. I've got some research I was just going over, so we have some people, so come on in.
Thank you.
Okay, well, with that introduction, and again, I'm going to be brave, and I'll say it one more time.
Everybody checks.
That's usually I yell at people and then I say, for goodness sakes, how can you do that? And then my phone goes off to prove that I'm a... Okay, so follow us on Twitter, friend us on Facebook, so you can get the updates on the videos and
Do you have to do both, or is one good enough?
That's a good question. I don't know. I have heard people who, quote, friended me on Facebook. So I've turned friend into a verb. And they haven't got the updates. So my bias is I would do both. And then if it turns out you're getting duplicates, you can shut one down. But I have a lot of people who've chosen to join a friend on Facebook who are not getting the updates because there's some reason it goes to the wall, and that may or may not appear on your wall, etc., etc. So we talk about a lot of things. My bias is just sign up for both, and if you start to get duplicates from me, you can always cut back. But right now, we don't have very many people that are using Twitter and Facebook to get information from me, and they're missing out. This kind of research this morning, I would love it if all of my 6,000 plus patients got this research this morning, and they're not getting that. So we're starting to say, how could we do that? Well, one is we could say, I demand, and you filled out a form that you solemnly swear you're going to come to clinic. Now, if there was a financial penalty or something we could work out, but I mean, so most of our patients, though, don't, do a very good job at getting back to clinic. So how can we reach out to them? And certainly we have email, we have the mailing list. The problem with the mailing list is you've got all the new patients who are constantly asking the same question over and over again. Like, oh my gosh, 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 do I have to eat yogurt? And that's good for our post-ops, but only for so long. After you've heard people worry about eating yogurt for about a year or two, it starts to get old, and you notice our post-op patients start to drift away from the mailing list. So the mailing list, I think, is a really valuable tool, and we send people back there frequently to stay part of it. But a lot of it is new people with new questions. And their new questions are actually old questions if you're a former patient, because you know all the answers, you've been through it all. Like, I need a contact, and you get these tense people who have scheduled their surgery for 4 days from today, and they need their contacts, and they're all tense about it, as opposed to getting their contacts first. So there can be some problems with using the mailing list for information, and that's where Twitter allows you just to get my emails about stuff. And so we like that. Facebook, in theory, should work, but the question is, some of our patients who have actually set me up as a friend are not getting all of those videos. So for that reason,
Maybe they blocked you.
they could, well, if like I have, I think it's 5,000 or 6,000 friends, and I can't have all of their updates appear, so I do turn off a lot of them. So again, you might choose not to get every one of my updates on your Facebook page, which is fine, but then what you do want to do then is make sure that you're on Twitter to get those updates. You still might want to be on Facebook, because you can drop in every once in a while and see what people are writing on my webpage about the surgery and things like that. So just recently we had a patient who's a psychologist from North Carolina who's over 10 years out. She said, I just stopped in to say hi. I've kept my weight off. This has been wonderful. She didn't mention it, but we also operated on her mom. And she is a retired school teacher, and so they're both 9 and 10 years out. And so it's nice to have both of those resources for the rest of your life as you go forward with the MGB. And in the past, if you think about it, there's been a progression of communication options with your doctor. I mean, in the 1800s, you'd go see the doctor, and maybe a telegram. And then we got this wild new thing, the telephone. And you can imagine maybe in the first years of the telephone, like some crusty old doctor yelling at another doctor saying, I can't believe you use that crazy telephone. You got to see somebody before you talk to them. And then, of course, I used email, and I can tell you that I had tremendous criticism for using email to talk to patients. And I had a web page, and my university said, you better take that down. It's not really a good idea for you to be communicating with your patients on an internet web page, which now is just kind of the most foolish comment you could make. So anyways, I'll say it one more time. Follow me on Twitter.
I don't even know how to get on here.
At the bottom of all my emails,
Okay.
there's a link which you can click on to get to Twitter with my name and to Facebook with my name, so it can start you on that route. And it's true, it's still pretty new, so a lot of people don't know about it, so it's worth taking the time and effort, because you're going to get this stream of what I think is pretty good information. It's not perfect, but I'm thinking about you every day when I do my readings. And if you think about it, the nice thing about having me on that stream of information is all I think about is the MGB all day, every day. So there are other good doctors and surgeons who have a variety of interests. All I think about is the MGB. All I think about is weight loss, the latest drugs that are being offered for weight loss, and every one of those things now, you can get a stream of information from an expert on that topic in your inbox. And I think, to put it kind of bluntly, it's unwise to miss out on that. and your health care will deteriorate. You'll have less high quality health care if you miss out on that stream of information that's easily available. It's kind of back to one of the times about 5 years ago or so, we had a patient, a gentleman who was actually our second patient here in Nevada, and he was at a seminar we were having in California. And he said, I'm really interested, and we had about some 10 post-op patients because we had advertised and things like that, and we were all talking, and he said, I really want to do the surgery. He said, but, you know, in a question to me, he said, I don't know how to use the computer. And I hope I wasn't too blunt, but I was kind of blunt, and I said, well, you can't be a patient of mine. I feel like to be a reasonably safe patient, to have the quality of health care from me nowadays, you need to be able to use the computer. You need to be able to get on the internet. You need to be able to Google things like that. And he you know, was a little taken aback. I thought he was pretty nice about it. But a whole bunch of people in the audience there said, we'll help you. We'll show you how to use the computer. We'll da-da-da-da. And he and his daughter both had surgery here. His daughter was actually the first patient that had surgery here in Nevada. And they're both now about 6 years out and doing terrific. But it was interesting. The computer becomes part of your health care. And I've even had people say, well, I don't have a computer. I said, well, one of the first things I would do, even if you don't have the surgery, the most important healthcare investment that I think people can make these days is a computer. And that sounds very wacky, but I think that, you know, really the world's changed. And for example, patients call me all the time and they say, my doctor wants me to take some medicine, drug X. Should I take it? And I go, there's so many medicines, I cannot keep up with all. I know if you ask me about aspirin, I have a kind of a stock answer. If you ask me about Tylenol, I have a kind of a stock answer because I pay attention to those drugs and they're very common. But what we suggest, if you get a recommendation from your doctor that you have leukemia or heart disease or something else, even a cold, the first step you should do is ask the doctor who's prescribing it, what are the risks? What are the side effects? The second step is when you go to pick up the drug, ask the pharmacist. That's their business, is to worry about drugs and side effects. And of course, you know, read the package insert. But the third step, and the reason I bring it up as part of this discussion, is I would Google it. You know, that is, do a search on the internet, and if your drug comes up with 10 law offices in Arizona,
Bad choice.
you know, have you taken drug X? Call the offices of Sokolov, and Goldwater. There may be monetary damages, you know. If you see that, well, then you should investigate that. And leaving that out of your health care, to me, is a foolish mistake. I think it's something we can easily take advantage of. And even if you count up the cost of a computer and this and that, I mean, even most of us, you know, have cell phones, so you could look it up. So that is so valuable. And that is something that is pretty broad spread. Now what I'm telling you this morning is new stuff is Twitter and Facebook, and they are going to be part of your health care if you take my advice, and they can help you. I think I'll make that a whole separate video, that tirade.